I'm Dr. Pearl.
Hi, Dr.
Can I have your name, please?
Yes, my name is Ivy.
Okay, last name?
B.
Okay, perfect. And your day of birth, please?
Yes, it's June 22nd, 1992.
Okay, perfect. Okay, Ivy, and what brings you here today?
I've been feeling a little bit bloated lately. I just feel it usually after I eat, and it just didn't used to happen before. It usually goes away within maybe a couple hours after I eat, but it's just uncomfortable.
Okay. Is that just it? Is that just it that you're feeling only floating?
Yes.
Okay, perfect. Well, let me ask you first a few questions before going through your symptoms. Can I have any childhood illnesses that you have? Okay. Or any recent illnesses?
No.
No. Perfect. Any recent surgeries?
No.
Okay. No surgeries. Okay. Any recent tests or exams that you have recently? No. Just
I did my annual examination about a year ago. All my blood tests were normal.
everything went well. Okay. Any allergies?
No.
Okay. Any current medication?
No, I just take vitamins, like a multivitamin.
Okay. What type of vitamins?
I do the like an Ollie women's multivitamins.
Okay. Just it, not a specific like vitamin C or vitamin D.
No, it just has a lot of them.
Perfect. Okay. Any family history illnesses?
Yeah, there's thyroid issues on my mom's side, and some heart issues as well.
On your mom's side?
My mom's side.
Okay. No illnesses on your dad's side?
None that I can think of.
Perfect. Any diabetes or
No,
heart condition?
I don't think so.
Okay, perfect. Okay, did you smoke?
No, never.
Not vaping?
No.
Okay. No smoke, no vaping, perfect. That helps a lot. Drinking?
I don't usually drink. It's been probably over a year that maybe I'll have a drink every 3-4 months.
Okay, perfect. Okay. Do you drink coffee or caffeine drinks?
Yes, 1 cup a day.
It's regular coffee or tea?
Espresso.
I don't blame you. Okay, how about your diet?
So I'm pescatarian.
Okay.
I was vegan for 8.5 years. But I think it's been maybe 2 years since I started incorporating fish and some dairy. But overall, I would say pretty balanced.
Okay. So about 2 years ago, being pescatarian. Any recent change in your diet, like adding any different kind of fish right now, or
No, nothing that I can think of.
regular diet? Okay. And do you have any birth control pills or? Okay. Perfect. Okay, so let's move to your symptoms. You said you're being bloated, a little bit bloated and inflamed on your abdomen specifically.
Yes.
Do you see on the upper part?
I think just like around the belly button, like just in general area of the abdomen.
Perfect. And where do you notice? When do you notice it did start? It started.
I think it might be like about a month ago. I thought it would go away, but it just hasn't.
A month ago. Okay. Have you been under recent stress in work or?
Yeah, I would say I'm probably a little bit busier than usual the past month and a half.
Okay, a little bit of work stress. And it's been a month since you first noticed. And is it continues during the day or comes and goes?
It comes and goes. It's usually when I eat.
Okay.
Maybe for a few hours after I eat, and then it just goes away until I eat again.
Okay. Can you describe the kind of pain or the way that you feel with your bloated? Is it like pressure or tightness, or how can you describe
I think
it?
it's like tightness maybe, but you can visibly see the belly being a little bit distended, or if that's the right word, like a little bit bloated visibly. And yeah, it just feels like a little bit tender to the touch. I did forget to say my mom has a history of IBS, irritable bowel syndrome, so I don't know if that could be
That's important.
related.
Maybe yes, on your mom's side. Well, your mom, right?
Yeah.
Perfect. Okay, and you said that what triggers the symptoms is usually when you eat.
Yes, I haven't really pinpointed like what kinds of foods. It's just usually I eat whatever I eat, even if it's like light, just like a snack, something. It just happens.
Okay. And do you usually start with your food and then drink at the end, or while you're eating, you're just taking some sips, or you just move to the end?
I think so. I haven't really paid attention, but I think, yeah, I just drink water at the same time while I eat. Yeah.
Yeah, that's important. Sometimes we don't pay attention, and that can be a trigger for this. And do you have any other symptom other than this?
Nothing that I've noticed, just that.
Only the bloating.
Yeah.
No any kind of dizziness or nothing. Okay. Perfect. Okay, Ivy, let me just write down today's date. And okay, let's just start moving. I'm just gonna first take your vital signs just to have the record here in the chart, and then we'll move on to your inspection. Okay? Perfect. So first I'm gonna take your body temperature. Just wait a few seconds. Okay, 9.7. Body temperature 90.7, which is perfectly normal. Let me take your oxygen. Let's just wait again a few seconds. You can just take deep breaths. 96, which is absolutely normal. Take your this is the right hand. I'm gonna take your blood pressure. It's gonna be a bit tight. You can just leave it right there. It's okay, you can leave it right here. I'm gonna feel a little bit of pressure. Let's check it again. Okay. 120/80. Again, it's perfectly normal. Are you okay? You feel
Yeah.
okay. Okay, let me write down your blood pressure. It's normal. 120/80. Perfect. Okay, Ivy, let's just move forward. I'm gonna ask you to lie down on your bed, and we're gonna start with your abdominal examination.
Okay, thank you.
Okay, let me just hold your hair so that you will be comfortable during the process. And okay, let's get started. I'm gonna move a little bit up your shirt. And I'm gonna open your pants. I'm just gonna pull it a little bit down so I can take a better look. Okay. I'm gonna put on my gloves so I can inspect properly. Can you warm this up a little bit? Okay. Okay, first I'm gonna start taking a look with my stethoscope to see if I can hear any abnormalities or something that comes up. Also, it's gonna be a little bit cold. Okay, I'm gonna start. Let me just hear more around the belly button area, which is where you describe your symptoms go around. Okay, I don't hear anything abnormal. Okay, I'm gonna ask you to please give me a very deep breath. Release. Okay, again. 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 One last time. Okay, one last time, please. Okay. Well, I just hear nothing but the regular intestinal movement. You telling me that this is the area where you usually feel, not down here, not the lower abdomen, right where the belly button.
Yes.
Okay, let me start. I'm gonna start palpating.
Okay.
I'm gonna put a little bit of pressure. Please let me know if you feel anything uncomfortable, okay?
Okay. Right there, it feels a little bit uncomfortable. Okay.
How about here?
Yeah, that too. Not anymore.
There.
A little bit, not as much. No. Yeah, kind of like right there in the middle.
Okay, I'm gonna put a little bit more pressure.
Okay.
Maybe it's gonna be a little bit painful. You just let me know.
Okay.
I just need to feel it very deep, okay?
Okay. Yeah, it's a bit uncomfortable.
Okay. I'm gonna try to mark down a little bit the area. Just gonna trace a few points. I'm gonna trace that area where you're feeling. Just to delimit. And section it in between angles. So now I'm gonna start measuring to see how different is it you're feeling in notice of measurements. Six. Okay. Let me see here your lungs. Here your down area. Here. Okay. Okay. Well, everything seems perfectly symmetrical and not standing that much in this area, which is the one that you feel bloated. So we are good with the measurements. I'm gonna start again, adding a little bit of pressure with this pressure tool, okay? So just let me know if you feel any uncomfortness.
A little bit there.
There.
Yeah, there too. That too.
Okay, do you hear that?
Yeah.
It's a little bit of air. It sounds different this side.
Yeah.
Any pressure in here?
No.
Any pressure here?
No.
So it still feels in here is a little bit different, right, on this and this section.
Yeah.
Just the area inflamed. Okay, we're gonna start again now. Doing a little bit of skin pulling or pinching.
Okay.
Okay, let me know if you feel any discomfortness. Okay, it's gonna be a little bit pressure here, okay? Okay, it's harder to take a pinch here where it's a little bit more inflamed. We can grab it a little bit more on the side. Perfectly normal. I'm gonna start adding a little bit of pressure with this tool. It will help to release a little bit of the tension that you're feeling. Okay. And I'm gonna do the same but with this pressure point. It's just different kind of system, so you're gonna feel this, okay? I'm gonna alternate between sections. This will help you to distend a little bit more of your tightness. Okay. I'm just gonna remove the marks that we showed down. I'm gonna try to clean them up a little bit. Just take another one. So this won't stain your clothes. And let's remove them really, really well. Okay, now you're looking like you have a plastic surgery. But that's okay. The wrist will be washed out from your shower. Okay. There you go. Much better. I'm gonna grab this set of brushes. Trying to stimulate blood pressure and irrigate a little bit more of blood sensation here in your abdomen. Okay, perfect, Ivy. I don't see anything that might concern. I'm just gonna give you a prescription for some medication that will help you with the inflammation, and you will just have to remove a few things from your diet to see if that is what we are having the problem with.
Okay.
And if you need extra help, I will recommend a lymphatic drainage, all with combined with the diet and the medication will help you a lot. Okay. So I'm gonna put your blouse on. I'm gonna again cover your, close your pants out. And whenever you're ready, I'll see you outside, okay?